Hi, I'm Melina Kambitsi, Senior Vice President of Business Development and Strategic Marketing here at the Alliance. I'm talking today with Sarah Hames, Principal with NBS Advisors, who has more than 30 years of experience in employee benefits consulting. Sarah has dedicated her practice to helping employers disrupt and transform traditional healthcare into sustainable delivery models. Thank you for being here with us today, Sarah.
Well, thank you for having me. I think these conversations are really important.
By asking, what do you think are the top strategies employers should be looking at when it comes to their healthcare benefits?
Well, I believe they really need to start with independent primary care. And that word independent is so important. Most of the system care that we have today are the doctors, even though they can be, and many of them are great doctors, most of them now generally have a conflict of interest in that they are charged with treating their patients, but also with raising revenue for their organization. And so referrals to specialists, tests, et cetera, become way more the norm than the exception. And the independent primary care providers don't think about healthcare that way. In fact, most of them have left the system to really concentrate on treating the patient in a very holistic environment. And I think that is so important. So I think that's probably the best place to start. But beyond that, then when you need to refer, people to MRIs, other imaging, more care with specialists, et cetera, they need to understand, where to send these people, because there's that huge range in costs for the exact same procedure in the exact same market. That's where people like you, Melina, and the Alliance and myself can really make a difference.
What should employers be looking for when it comes to good partners, Sarah?
Well, first of all, I think they need a good guide. And that person is generally their broker, their consultant. But they really need to determine how innovative that broker or consultant is. And that's really an important first step. I've seen it time and again where it's actually the broker who will hear the idea and then steer their client back to the more traditional ways of healthcare, because that's what they are comfortable with, and that's generally what supports their revenue, in their brokerage firm. So you have to make sure that all of these different partners align. You need a good third-party administrator who has embraced these ideas, who've done things in this space before, who can help guide us as well. You need a network like the Alliance who is willing and eager to point out who the high value providers are and who to steer away from, quite frankly. Beyond that, you need a good PBM. You need a good primary care physician. I mean, who are you going to choose to steer people to? And will they support that referral system out to the high value providers? You need that good care navigator, et cetera. So all of these partners really have to collaborate, really work hard together and feed off each other. I mean, if somebody sees something going a little astray, let's rope it back in, let's re-examine it. Let's, really make this work.
So what are the biggest hurdles to self-funding, Sarah? What do you see in the market?
I think the first big hurdle, Melina, is really the way we think about healthcare. I mean, we have been programmed, to think about it in terms of what the big health plans offer. We know healthcare is broken. And if we keep doing the same things over and over and over again, we're not going to get any different results. The results are going to be the same. So it's not going to be impactful at all. We think about how do we do this differently? And I know it's difficult for some. Either they've had a bad experience with large claims in the past, or if you're a public sector, you're using taxpayer money, to fund your benefit plan. And I think they look at self-funding as being a high risk. To me personally, after I've looked at the numbers from so many clients, et cetera, it's really a greater risk to just stay fully insured and do nothing at all. But I know at the Alliance, you've had some really good success stories too. So are there a few you could share with us today?
Yeah, so I will not get specific with specific employers because I haven't gotten their permission to use their names. But you're absolutely correct. Both in the manufacturing and in the public sector, we have had a tremendous amount of success with exactly the same strategies that you're describing. So about 3-4 years ago, we started tiering the network, taking the Alliance network and having the ability to create different tiers of value, cost and quality value of providers in these tiers. Promoting and being a very big proponent of independent primary care, and also not just promoting independent care, primary care, but also working with independent primary care providers to help them refer, help them access the data to refer to the different tiers appropriately. And also working with employers to help them make better choices when it comes to benefit design. So we have seen many companies that have not had to raise their premiums, meaning the out-of-pocket cost of employees and their families. They have given better benefit design to their employees and their families. They have provided free healthcare that costs people nothing to access. In fact, some of them not only offer this free healthcare, but also incentivize, even in addition to that, so that employees can take time off and travel if they need to travel and take care of themselves and their families. And then, as you also said, having a good care navigation vendor to help answer all these questions. So you can now access, as an employee, you can now access patient advocacy from both your primary care provider, but also from a registered nurse or an NP at the care navigation firm, at the care navigation vendor, to help you through the chaos, right? The maze of healthcare, of systems and healthcare. So yes, we have seen, and then at the same time, these employers are now spending much less money on their total healthcare than they did 4 and 5 years ago. So that is very successful. It's very heartening. It really is why we're here at the Alliance and why we do what we do. I want to talk a little bit about employer fiduciary responsibility for their self-funded health plans. More recent regulation is bringing the fiduciary responsibility to the forefront. Can you and I, explain the employer's fiduciary role and maybe how that particularly applies to public accounts, Sarah?
So I think it's a really good initiative. I think it's somewhat hard for employers today to live up to that because of all the data they don't see. So how are they going to go about this? But I'm going to ask you to really expand upon this a little bit more because I understand you've had some training around, the regulation.
Yeah, my pleasure. So yes, as Sarah said, I am getting board certified on the fiduciary duty to self-funded health plans. I'm very thankful that the Alliance is training me and allowing me to serve and as an expert for our employers. There is definitely several components that are now they're part of the regulation, and now they're becoming very important for employers to know. Sarah mentioned one and a half. So Sarah mentioned one, and that is know exactly what you pay your vendors. And that is not just the PPM or the monthly administrative fee that they charge employers. So we need to be looking at exactly what we're spending for our self-funded health plans from multiple perspectives, right? Also, having access to data. And that is something that's near and dear to my heart because the years of large insurance companies telling us we can't get a hold of our data, we cannot know our data, the data doesn't belong to us. Us as employers, self-funded employers, we need to have access to our data. So understanding the claims costs, the conditions of our population, the associated risks with the condition of our patients, and also understanding what actions we need to take to be in terms of benefit design, in terms of incentives, to be able to manage appropriately as fiduciary stewards, as fiduciary financial stewards, manage appropriately our self-funded health plans. Also, we need to make sure that in our contracts there are no gag clauses. So the Alliance provider contracts have no gag clauses. We have maintained for as long as we've been in operation, we've maintained that the employers need to have access to the cost of care. So not only have access to the claims data, but also know ahead of time what is the cost of care that they need to provide their employees, their families, their patients. So these are some pretty important elements of being a fiduciary leader and leading financially viable and affordable self-funded health plans. And I'm very passionate about this work. So there will be more discussion in the future about how to lead as a fiduciary and how to maintain one's fiduciary responsibility to the health plan. Thank you very much for today. Thank you for the time you've spent with us. But thank you so much on behalf of our employers, the Alliance employers, for all you do to help us change our healthcare ecosystem.
Thank you, Melina. It is a pleasure working with the Alliance and all of the other people that are as interested in changing healthcare and as passionate about it as you and I are. And I think that's really what makes the difference. What I'd like employers really to understand is that healthcare, the traditional healthcare, has no motivation to change itself. If you look at the winners and the losers, the insurance companies, many of the hospitals, not all of them, but many of them are really benefiting from, the current system. And it's employers that are participating in the Alliance and organizations like the Alliance and myself and NBS Advisors that really, that's our sole motivation, is to really change healthcare and do what's best for the employers. So thank you for this opportunity. It's really a pleasure to be able to participate in a really noteworthy discussions like this.
Thank you all for your time today. See you soon.